Welcome back to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal with Shannon O'Kelly. Time for our next guest, Dr. Alexander Willis, orthopedic surgeon at Skagit Regional Health in Mount Vernon. And we're going to be talking about hip and knee replacement surgery and recovery. Shannon and I have had both my knees done. It's been a while, so I'm sure there's some great new information.
Ron, isn't it amazing? I mean, you get these hips and knees replaced. I mean, you have this quality of life change. I mean, everybody I talk to that has significant arthritis and decides to get a replacement of their hip or knee, after 2 or 3 weeks, they are so glad they did it. And the technology and the advancements, when you look back 34 years when I started physical therapy, I mean, the advancements in the intervention, the rehab, the recovery, it's amazing. You're exactly right. We're going to talk about that.
Here's some new information with Dr. Willis and Shannon O'Kelly.
Dr. Willis, welcome to Health Talk. How are you doing?
I'm doing well. Thanks for having me.
Thanks for joining us. Thanks for joining us today on Health Talk. And Health Talk is a show that we talk about health and various topics. Today, we're going to talk about arthritis of the hip and knee and what we can do for that, or what you can do for that as an orthopedic surgeon. But before we get into that topic, tell our listeners about your practice, your training, your background, your interest in orthopedics, and why you have an interest in hips and knee replacement or total joints. Let's start there.
Yes, I'm a board-certified, fellowship-trained orthopedic surgeon. I first was interested in orthopedics after I had a pretty bad basketball injury. I tore my ACL, and I had surgery for that. And I got really, I was really excited to see how fast I was able to get back playing the sport. And so that kind of turned me on to orthopedics to start with. And then after I was in medical school, we have to see multiple different types of surgeries, and I saw a hip replacement. And I just thought it was amazing how tangible hip replacement is. You can take out somebody's diseased bone and put in a brand new replacement, and it works just as well. And just being able to see that tangible difference in the architecture of the joints, and then seeing a patient walk into the office a couple of weeks later without any pain, with all of their pain relieved, I just thought that was one of the most amazing things I had seen. So that's what kind of spurred me on to wanting to do hip and knee replacement.
And when you talk about a fellowship-trained orthopedic surgeon, your fellowship is in, I would assume it's in reconstructive total joint. So that is an additional year beyond your normal residency program, just working in total joint reconstruction. Is that fair to say?
Yeah, that's right. I did an extra year doing total joint replacements, and I actually did musculoskeletal oncology during that time as well, which is treating any kind of tumor of the soft tissue and bone, anything in the musculoskeletal system. So it's combined in that sense. We did a lot of complicated total knee and hip procedures with a heavy focus on total joint replacement.
Interesting. How long have you been up in the Skagit Regional Medical Center there up the Skagit Valley?
So I'm actually pretty new here. I only started at Skagit Regional Clinic in April of this year. But prior to that, I was in private practice in Philadelphia. I wanted to make the move out west because my wife is actually from here, and we have 2 little kids, so we wanted to be closer to family. So I came out here, and I love it.
Yeah, well, welcome to the Northwest. I got to ask you, though, real quick, are you a Philadelphia Eagles, or have you become a Seahawks fan? You don't have to tell me, but if you're comfortable with that, I mean, you're probably leaning towards the Seahawks after you get to know them a little bit, huh?
Yeah, I better say Seahawks.
Yeah, you bet. Yeah, that's probably a good answer. Well, hey, good to have you out here. And so, a lot of people, when they look at, obviously you're getting a joint replaced, you talk about oncology and some of the maybe cancer, but also it's just kind of a natural progression. Sometimes people have arthritis. So maybe that's where we should start. Arthritis of the hip and knees, kind of that osteoarthritis. Maybe talk about that type of arthritis, the wear and tear stuff.
So there are multiple different types of arthritis. Overwhelmingly, the most common type is osteoarthritis, which is just your mechanical wear and tear of the joint over time. So most of the patients with osteoarthritis are on the older side, between 60 and 80 years old. And that's just because their joints worn down. And what we'll see on the x-ray when people come to the office is all the cartilage between the bones is really worn down to the point where they're bone on bone. And that can cause a tremendous amount of pain. It can vary person to person, and it can even vary within the person, meaning that some people will have a couple good weeks, and then they'll have one really bad week when the weather changes, and they'll be in agony. And so that's kind of the overwhelmingly the most common arthritis we see. There's also arthritis that people develop after a bad trauma or because of an autoimmune condition. and we see a fair amount of that as well.
We'll be back with more with Dr. Alexander Willis, orthopedic surgeon at Skagit Regional Health in Mount Vernon, and Shannon O'Kelly after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Welcome back to IRG Physical and Hand Therapy's Health Talk. Time for more with Dr. Alexander Willis and Shannon O'Kelly.
Dr. Willis, again, thank you for joining us. You're doing a fantastic job. What you're explaining is sometimes our joints wear out because of arthritis. And as a physician, orthopedic surgeon with a fellowship in total joint reconstruction, what do you tell your patients? When is it time, to get that joint replaced?
Yeah, it's a great question. It really varies person to person, and generally the surgery is a last resort for most people, and most people kind of know when it's time, and that's when they've really tried all the non-surgical things. They've tried injections, they've tried physical therapy, they've tried ibuprofen, and they're still having pain. They can't go for that long walk with their spouse, and they're suffering and they can't do their daily activities. So that's really when I tell them it's time. So
for you, it really comes down to quality of life, and that quality of life, with the joint replacement can be. I've seen it. I've personally seen it in a lot of patients. It's significantly enhanced. So when you're ready to make that decision and have these joints, whether it's a knee or hip replaced, maybe talk about that. Just the process, the replacement, the time to heal. And I guess the joy of people moving around without pain when it's finally done. I've seen a lot of that too.
Yeah, absolutely. So, I always tell patients that I find joint replacement to be a bit of a misnomer, just because what we're really doing is resurfacing, for a knee anyways, we're resurfacing the end of the knee, the bottom of the femur and the top of the tibia. We're making some cuts in the bone and essentially replacing those areas with metal implants. And what that will allow is the patient's joint to move without pain. At first, of course, the surgery can be painful, and patients are usually on some pretty strong pain medication for the first week or two. But after that, they're able to walk pretty well with a walker. They gradually transition to a cane, and usually by about somewhere between 6 weeks to 2.5 months, they're walking pretty well with pretty minimal pain. For hip replacement, the recovery is even faster, and I actually have a fair amount of patients that have pretty minimal pain throughout the whole process.
Yeah, most of the time, my experience with patients, they usually tell me is like, wow, I wish I would have done this sooner. But it is a quality of life situation, when you know, but it does change people's lives. When you can now walk without hip pain or knee pain, or get back to those activities that maybe you stopped doing. The technology is amazing. I've been doing this 34 years, started my first job was at Swedish Hospital in downtown Seattle, fresh out of PT school 34 years ago. And the technique, the technology, the prosthesis, the advancements, it's amazing. It's mind-boggling.
Yeah, there have been some huge advances, and I tell people now that we anticipate these joints to last more than 25, more than 30 years in most cases. So I tell patients that are even younger and younger, you should really consider it. If you're having an issue that's affecting your quality of life.
Welcome to the Northwest. Welcome up there at Skagit Valley. And how about if we have you back on? I'd love to catch up with you and just see how things are going maybe in 3-6 months. Maybe we can dive a little deeper in maybe some options of repair or hardware, et cetera, okay?
Yeah, absolutely. And thanks again for having me.
Great information from Dr. Alexander Willis, orthopedic surgeon with Skagit Regional Health in Mount Vernon about knee and hip replacement. Great stuff, Shannon.
Yeah, like I said before, this segment, it's amazing. I've been doing this 34 years, and when I first started, a total hip, total knee, you went to the hospital, you were in the hospital for 2, maybe 3 days, and then you went home. In today's world, you're doing these things in the outpatient center. The surgical techniques, the advancement in the prosthesis, and the recovery and rehab is just fascinating.